Okay, here we go. We are getting started here. Sorry, I'm a little late. Thank you for joining us. And today we are talking about diabetes. We're doing part two. Okay. A couple of days ago, a few days ago, we started the diabetes series, part one, and we talked about some of the causes of diabetes. We talked a little bit about some of the signs of diabetes, and then some of the lab testing as far as A1C is concerned, and what are the different um, values of the A1C and what they mean. So we talked about that. Um, and and pretty much that was it. A little bit about some of the foods that we could eat that helps diabetes. But today we're going in deeper with foods. We're going in deeper with some of the signs of low sugar, signs of high sugars, and then what to do about the high sugars. In other words, what to eat, how to eat, okay, and what not to eat, what to avoid. Okay, so let's go ahead and dig in. First, let me talk about, let's see, let me put this so I can see it better. All right. So first, I want to talk about what are some of the signs of high sugars, and then let's talk about some of the signs of low sugars. Okay. So high sugars. Another word for high sugars is hyperglycemia. Okay. So I'm going to put that in the chat in capital letters. Hyperglycemia. Glyce, GLYC refers to sugar, glucose. Okay, glycemia. High sugars. What are those? What are some of the signs of high sugars? Blurred vision, when you're not able to see very clearly. Another obvious sign is tiredness, being very tired, exhausted. Um, and this is another sign of high sugars. Another sign that you may not realize is thirsty, very thirsty, or extreme hunger. More hungry than normal, more thirsty than normal, and you wouldn't think that that would be a sign of high sugar. But check it out. I'm reminded of when I was in medical school of how our professor would say, one of our professors, a biochemical doctor, he would say that diabetes is starvation in the land of plenty. So it's almost as if your brain is not getting enough sugar. The other parts of the body is not getting enough sugar to it, like the muscles and the vital organs of the body. They're not getting enough sugar, but there's plenty of sugar in the blood. So the blood has the sugar. It's a lot of sugar in the blood, but the vital organs that needs the sugars not getting it. So the brain is not getting it. So the brain is saying, "I'm low in sugar. Give me more sugar." And it's telling your body, thirsty, get thirsty, drink some, some water, but also eat some food. I need more sugar. And so it's odd, it's different. um it's very different, and I think and it's kind of interesting. Some of the signs of low sugar are some of the signs of high sugar. So again, fatigue, tiredness, that's a sign of low sugar and a sign of high sugar. Blurry vision, not able to see well, this is a sign of very low sugar, when the sugar is getting pretty low, very low. And it's also a sign of high sugars as well. So it's just very interesting. um, okay, other signs of high sugars would be um, frequent urination. Okay, so let's talk about that. So when you have a lot of sugar in your blood, your kidneys tries to make up for that by pretty much dumping out the sugar out of the blood into the urine, okay? And that gives you the sensation you have to go pee. You have to go, and there's a lot of urine coming out, a lot of water coming out with that sugar, okay? And this causes dehydration. So the body, to prevent dehydration, the body says, Come on, let's drink some more water. We can't get dehydrated. And so it gives the signal to drink more water. So that's that high thirst. Okay. Very thirsty, having to urinate a lot. Okay, now, uh, and then fatigue, we talk about tiredness, getting tired easily. Just can't get that energy up. Um, Slow healing cuts. You get a cut and it takes a long time to heal. Takes longer than it should to heal. Um, a lot of people know this one. Numbness and tingling in the feet, that could be a sign of high sugars, sometimes burning pain in the feet. And then weight loss, if it's been a few days of or more of high sugars, uh, the body gets dehydrated. With that dehydration, the fluids, water starts to come off the body, and then that causes dehydration. Okay, and I'm sorry, weight loss that causes people to lose weight. Sometimes it could be an unhealthy weight loss that is considered unhealthy weight loss. Okay, for women, yeast infections, and even for men, especially men that are not circumcised, there's a chance of getting balanitis, I think it is called, whereas the effects of a yeast infection, like a whitish, clumpy kind of discharge, itchiness around the head, underneath the foreskin. Okay, that can happen. And in women, vaginal yeast infections are much more common. Even bladder infections are more common. There's going to be more urination, going pee more, and then there's sugar that shows up in the urine, and that's not normal. And so that can cause more yeast infections and more bladder infections, urinary bladder infections. And then overall skin infections, you could get more boils, you could get more red areas that are skin infections, it's the more acne, things like this. Okay. Now, let's talk about hypoglycemia and what are some of the signs of hypoglycemia. Okay, hypoglycemia is the opposite of hyperglycemia, and that is low sugar. So, some of the signs, like I said, some of the signs of high sugars are some of the signs of low sugar. Some of them that are similar. Let's talk about those first. Tingling, but this time more tingling of the lips, toes, and feet. That can happen too. But tingling of the lips, and by the way, my source, Mayo Clinic, Cleveland Clinic, online, these are very good sources of information. I'll go ahead and put that in the chat, Mayo Clinic. So I Googled, the term signs of hyperglycemia, signs of hypo. I put that in the Google and I chose Cleveland Clinic and Mayo Clinic. I like those both. Okay. Amen. All right, let's keep it moving. So fatigue, tiredness, exhaustion, that's another sign of um, low sugar. That's similar to high sugars. Um, let's see, another one. Hunger, okay. When your sugar is low, you could get hungry. Sometimes you can look pale, and sometimes you can have sweating, shakingness when you feel shaker, tremors, shaking, uncontrollable shaking and sweating, headaches. We sometimes call it a hunger headache, right? Feeling hungry, feeling nauseous can also be a sign of low sugar. Your heart beating fast or irregular palpitations, not regular heartbeats. This is a sign of low sugar. Fatigue, being irritable, anxious, not able to focus or concentrate, dizziness, tingling of the lips, like I said. Also, when it's getting bad, signs that the sugars are getting really low, confusion. You're not able to think straight. You're not able to do the things you normally are able to do easily and quickly. You're confused, unusual behavior, loss of coordination. Can't keep your balance, you know, not coordinated well. Slurred speech. This is when it's getting really low. again, blurred vision when it's getting really low, or tunnel vision where you're just seeing as if you're just only seeing a tunnel in front of you. This is when it's getting bad. Now, when it's really bad, when it's very severe, you might not be able to wake someone up. You're unresponsive, or seizures can happen. Loss of consciousness or seizures can definitely happen. Delirium, things like this. This is when it's really low. Okay. And if you're a family member of someone with diabetes, this is when, well, of course, uh, these are signs when it's starting to get really bad. Someone's confused. They're not thinking they're straight. They're not themselves. Their speech is slurred. It could be a stroke, or it could be just simply low sugar. So you can give them a glucose tablet, a little orange juice, give them some food, give them something that'll make the sugar go up quickly. Um, Usually juice, some kind of fruit juice usually makes it go up pretty quick. Um, and then there's something called glucagon injections, which t- um, I try to remember to prescribe that for patients of mine who are on diabetes medicines, especially if they're on insulin, because insulin is one of the number one reasons why people's sugars go low. And so glucagon is the opposite of it's an injection that does the opposite of insulin, so it increases the sugar levels over time, and it takes a little time to work, so we still try to get glucose tablets. And sometimes when someone cannot swallow because they're so out of it, a glucagon injection would help turn that around. And then, of course, call 911, call the ambulance, get them to the hospital as quickly as possible. 911 is faster than driving someone to the hospital because they get to you quicker. And then they could do things on the spot. They can start an IV and get sugar through the IV quickly. Okay, because this is when the sugars go really low. Of course, this could cause death. So this is considered a medical emergency. Okay. Um. All right. So now we're going to switch gears a little bit. And now we're going to talk about what are low glycemic foods and what are high glycemic foods. So it's important to know what the signs of low sugars and what the signs of high sugars are, because sometimes people don't have diabetes testing supplies, or if you run out of test strips, or you're somewhere where you don't have a machine to test your sugars, you need to know what are the signs of your sugars being too high, or what are the signs of them being too low. You can also Google. Google is wonderful. That's why I put, Mayo Clinic and Cleveland Clinic as resources to to be able to look up some of the symptoms as well. Okay, now we're going to move towards what is low glycemic. Low glycemic foods. It's called low glycemic index foods. So, what's the whole idea of glycemic index? Glycemic index helps us to understand how quickly the sugar goes into the blood, how high it goes into the blood, and then how long it stays in the blood. So typically, low glycemic index foods are typically foods that have lower sugar and higher fiber. It's like they slowly takes the sugar up, okay, in your blood, and then it stays at a nice level. It goes up, and then it stays at a steady state for hours, okay? High glycemic, on the other hand, is the one that takes the sugars up, takes it up, it peaks, and then it drops it quickly. So the sugars go up quick, and then they drop quick. So high glycemic foods would be something that you would want to give someone whose sugars are too low, okay? And that would help it go up quick. But then again, it comes down quick too, right? So juices, okay? So juices go in quick. They give you that boost fast, but then it disappears fast. So then you have to follow it up with a meal that would give you the low glycemic foods. Now, there's also in the middle. medium glycemic foods, okay? Or midline, right in the middle. Okay, so let's give some examples. Examples of low glycemic foods would be, let's see, I wrote them down here. Green veggies, okay? Most fruits, raw carrots, raw fruits, raw veggies, Kid kidney beans, okay? Those are the red beans, kidney beans, chickpeas, lentils. These are just examples, okay? There's other examples as well. But for the most part, the higher the fiber level, the lower the glycemic index, okay? Let's talk, for instance, I'll give you a good example. Apples, okay? So apples could come in the form of the whole apple, and typically, if you eat the whole apple and the actual, you wash off the outside of the apple and eat the skin is what with it. Now you have the apple with the skin, and so now you have a higher fiber level, and it takes a longer time for so the sugar level goes up steady over time, and then it just stays. So it goes like steady increase, and then over time it kind of stays in the system. It doesn't drop too low, it stays in the system. Okay. And so that would be a good example. And now the other form of apple would be what apple juice, especially the apple juice that comes not the kind you press yourself or put in a juicer, but the kind that comes from the grocery store. A bottle of apple juice is going to have quite a bit of sugar. So it's going to be a high glycemic index, and it's going to go into your body quick, quick. This would be something to give yourself if your sugar levels are going low and you're about to get in trouble. That's when you would go ahead and take some apple juice. Okay. So it brings it up quick, but then it drops it rather quickly too. So it goes up quick and then it comes down quick. So the juice has no fiber. It is like taking many, many, many apples and concentrating them into this juice. And so it is just taking the sweet part of the apple and putting it in form of a juice. And it's almost like liquid, sugar, natural sugar. If you get 100% fruit juice, it should be more natural, but it's in a different form. It's like, it's almost like an unnatural form. And so now it's concentrated. It's like, liquid sugar basically. Okay. Now, so we talked about low glycemic, lots of salads, raw fruits, raw veggies. Let's see. In general, the fruits that are going to have a lower glycemic, again, apples. Let's see what else. Um, Grapes are going to be more in the middle. A lot of the fruits are going to be kind of like in the middle, but there are some low glycemic fruits. Okay. Let me try and think. Plums, apricots, peaches. In general, the fruit that has the outer part are going to have low to medium glycemic index, where you can eat the outer part. Like you don't peel a grape, but you do peel a banana, and the banana is going to have a higher glycemic index. In other words, it's going to have a higher sugar content, lower fiber. Okay. So banana is not at the highest, but it's probably medium high. It's getting pretty high. Watermelon is pretty high as well. You don't eat the watermelon outer part, you discard the outer part of the watermelon and you get to the inside part of the watermelon. So in general, those kind of fruits where you have to discard the outer part and eat the inside of the fruit is in general it's going to have a higher sugar content or a higher glycemic index. Um, let's see other examples, low glycemic fruits. Let's see, cherries, especially like the black cherries, blueberries, blackberries, strawberries, things like this. Okay. And in some instances, when I looked it up, it was medium glycemic index. In fact, what I did was I put it in the description. So all of this information about the low glycemic and high glycemic index foods are in the description. Okay. Okay, now let's see what else. We are going to talk about now. Let's jump a little bit more to the other side of the category, and that is high glycemic index foods. We're almost done. I'm not going to be on this live long. High glycemic index foods will be now these are the foods again that go in the body quick and then they drop out the body fast. And this would make you feel lousy. Think about it. Um, this is why many people are tired because they're going up and down, up and down. Sugar levels are going up real high, and then their sugar levels are too high, and it makes them tired. And then it drops too low, and then now you've got that now you're going through withdrawals and almost, and you're feeling exhausted and tired. So it's like that up and down, and that's probably people get very tired throughout the day. So we want foods that give you that energy and then keep you sustained with your energy level. Cinnamon is another one. Sometimes that is a supplement that you could take. Putting cinnamon on your foods can help it have a little bit more of a lower glycemic and kind of keeps the sugars steady in your system longer. Cinnamon is really good for diabetes. Okay, so high glycemic in essence, potatoes, french fries, mashed potatoes, white potatoes, all the different forms of white potato, russet potatoes, etc. These ones are going to cause the sugar levels to go up high glycemic index. But if you put, let's say you have a baked potato and you put a bunch of veggies with it, now you've got the veggies and the baked potato. It now brings the glycemic index down just a tad. So it's not so high, but maybe it's in the middle. Okay, brings it down to the middle. So just keep that in mind. Pasta, noodles. These are going to have high glycemic index. Rice, white, especially white rice. Brown rice would be a little bit more like maybe in the middle, but white rice would be high glycemic. Okay, let me see. I have some other examples. So white bread, even the soft wheat bread, the wheat bread that's very soft. Um, it's more of a pulverized wheat, so it has less fiber. Donuts, okay, sweets, like I said, watermelon. Um, so the different types of potatoes. So in essence, bread, potatoes, rice, anything with flour that doesn't have a lot of fiber, low fiber foods. These are going to be high. Sodas, um, you know, candy bars, things like that. Okay. And then you have your kind of like medium high popcorn, ice cream, the sweet yogurt, spaghetti, corn, even couscous, which is supposed to be kind of like on the healthier side. But couscous, I believe, is made out of like a noodle material. Um, so even certain fruits like bananas. On this particular one, it says grapes, but I still consider grapes a little bit lower. Um, and so these are some examples. Now let's talk about some like low glycemic, a little bit higher than let's say a raw salad, um, green veggies, okay? A little bit higher than that, but still on the low side. Dark chocolate, nuts, okay? Certain beans. Certain beans have high fiber. So kidney beans, red kidney beans would be considered low glycemic, and then a little bit higher, and then maybe in the middle glycemic index would be uh, like lentils, okay? Lentils and other beans. Oatmeal is in the middle as well, like a medium glycemic index. So you can have medium glycemic index foods, but in smaller portion sizes, okay? Watermelon is healthy, right? Has a lot of water, but it also has a lot of sugar. So that one would have a very small portion sizes. So you can have the potatoes, you have the rice and so forth, but you want small portion sizes. By the way, I went to the internet and this is through Google, and I put examples of high glycemic index foods, and then I got this wonderful table by BIONIME. I'll put that as well in the live stream chat. So this is my reference from the internet. So BIONIME. I want to give credit to where credit is due. They have a nice colored looking glycemic index, and it talks about 0 to 10 glycemic index with examples: hummus, chickpeas, garlic, onion, green pepper, eggplant, broccoli, cabbage, tomatoes, mushrooms, to lettuce. So these are your green veggies, okay? Examples of a little bit higher, 10 to 30, plums, dark chocolate with a 70% cocoa, milk, whole milk, cashews and walnuts, lentils. So, different nuts, cherries, apricots, things like this. It's still considered low glycemic, but a little bit higher. So 10 to 30, 30 to 50, 50 to 70, and then 70 to 100. And that would be the very high glycemic. So it's really nice. It's a very colorful table here that you could put on your refrigerator, uh, you know, and share with your family. And so, in essence, just to help you remember, I actually worked with an ophthalmologist once, and she was trying to explain it because, when your sugars are too high and your diabetes, it can affect the eyes in a very bad way. It can even lead to blindness. So she would counsel the patients, and she would just say anything that's white or light, avoid. And I was like, okay, bread is light or white, avoid. Potatoes, again, white, the white potatoes, the white rice, um, milk. Milk is a little bit lower on the glycemic index, but still, just it does have sugar. So you have to be careful. There's milk sugar, it's called lactose. Fruit sugar is called fructose. So that was her quick and easy way. So bread, cracker, white crackers, even because it's made out of flour, things that are made out of flour, noodles, pasta, bread. That's a quick and easy way to think of it. White potatoes. Um, so that's a quick and easy way to think about it. Sweet potato yams has a little bit more fiber in it, and so it's going to have a little bit lower index, but it's still kind of in the middle there to high glycemic, a little higher on the high side. Um, Most important thing you need to realize is that in general, food ends up turning into sugar. All foods, okay. Now, protein with also like fish and chicken. It depends on what you put on the chicken. So if you put barbecue sauce on the chicken, the barbecue sauce has plenty of sugar in it. So now it brings up a little bit higher glycemic index, whereas, you know, boiled chicken without a lot of seasoning, you just put seasoning on it, but without the sugary seasoning on it, it will be a lower glycemic index. In general, proteins have a lower glycemic index. So that's why a lot of weight loss programs will say eat your salads, your fruits, your veggies. I mean, not your fruits. I'm sorry, your veggies, mostly the veggies and protein, and you'll lose a lot of weight. And that's true. But, how long can you do that for? And so we have to have some carbs to give us energy. Carbs gives us some good things about carbs is that it does give us energy. You just have to not have too much. Okay. Not too much is in moderation. Okay. I hope that helps you. I really do. And we are done for now. Took me a little longer than I wanted, but I think you got the picture. Repetition, repetition is important. All right. Until next time, we're going to try for next Saturday. I try to do these every Saturday morning, right around between 8 and 10 a.m. I try to get this live done. And so next Saturday, we're going to do part 3 of diabetes. There's lots to learn with diabetes. Okay, great. Have a great day.